So I'd like to welcome everyone. This is the Emergency Medical Services for Children Quality Improvement Collaborative for Pediatric Mental Health Care Access Programs. Our first part of this meeting will be recorded. Please follow instructions in the chat to provide us with the needed information. And our colleagues will be working hard to remind us of that in the chat. We are very excited to meet all today. Welcome. A quick reminder, this collaborative was created to provide guidance and support for pediatric mental health care access programs. These programs are expanding their efforts in providing pediatric mental health assistance to the EDs in their regions. Joining us today are my amazing EIIC colleagues, Jan Donathan, Hannah DeHoyas, Sherry Snyder, Kim Burkhardt, Angel Nguyen, and Eleni Bullers. Did I mention everyone of my team? Just want to make sure everyone have been mentioned. They are amazing and awesome team, and they will help us to facilitate all the activities during today's meeting. And with that, I'm going to give just a few seconds for Jen if I forgot anything to mention as an introduction.
And one final thing, there might be participants on who are attending from EMSC state partnerships, as well as emergency departments who are a part of last year's ED Stop Suicide Collaborative. If you fall into one of those categories, or if you're a PMHCA team who is just joining to listen in, we welcome you all and are really happy to see you all here today.
Thank you, Jen. We can move on to the next slide, please. We would like to thank HRSA for assisting us in providing funds for this amazing opportunity. We would like to move on to the next slide next. With that, today we will be providing introductions of all collaborative partner teams who will be joining this collaborative journey. We will also introduce collaborative work plan, and then we'll split in the breakout sessions to share AD expansion plans of the participating PMHCA groups with others. And we will finish up with the next steps. Next slide. So who are here? Who we are and what are the entities that are represented. We do have pediatric mental health care access programs who are expanding their efforts to the EDs. We do have emergency medical services for children state partner program representatives. Welcome, as well as emergency medical departments. I will go through each and every group to make sure that there is a clear understanding of each program, as they are very unique and very engaged individuals. The next one. So PMHCA programs, those are federally funded programs. They're typically located in with state departments and state and health departments. There has been a history of with them is providing children's mental health, mental and behavioral health support to pediatric primary care, with some expansion to the EDs as well as schools. The services that they offer vary by the program. They could be provider consultation services, provider training and education, and patient resource connections. Next slide. So today, I'm very happy to introduce these programs. We have now so many teams, and it's very exciting for us to have this participations. So our new teams are listed. Well, actually, all the teams are in blue on this map, but the new teams are Chickasaw Nation from Oklahoma, our Iowa team, our Minnesota team, Mississippi, Nebraska, North Carolina, Ohio, South Dakota, Vermont. We do have a participant from Virgin Islands. It's an EMSC state partner individual, as well as returning teams from Delaware, Michigan, Oklahoma, Tennessee, and Washington. All are welcome. To give a little bit of a background about PMHCAs, this is, again, as I said priorly, a state-funded programs. They are almost in every state. So what's interesting about this map shows us exactly which teams are expending their efforts to emergency departments and which teams are expending their efforts to schools and which ones to both. So we'll keep the slide up just for one more second so folks can orient themselves. To learn more about these programs, we have included the website here on the right, and that would be available after this presentation to connect. Next slide, please. All right. So EMSC state partners, individuals that are joining us today, a little bit of a ground about this program. This is also state-funded programs. They were housed in the state EMS offices, but their location vary. They support all 57 states, territories, and jurisdictions in meeting the needs of children in their emergency care systems. They develop, implement, and share pediatric-ready resources, tools, and other opportunities in their states. They build relationships with hospitals, pre-hospitals, teams, and experts directly impacting pediatric emergency care. They have an enormous scope of work. And so with the next slide, I wanted to show some of the initiatives that they're involved in even further. So as you see, lots of initiatives. Behavioral and mental health access is one of the newly initiatives, and one of the measures they're coming with if they are expanding in and wanting to recognize their programs. So this is one of the, again, newly initiatives and measures that would be in their interests. As you can see on the slides, there's lots and lots of information and lots of initiatives that they're involved. And did I forget something? I might have.
No, we do have a slide though that shows where you can find your state partner in your state.
Oh, that's right. Thank you. That's our next slide. And this is how you can find the programs, the EMSC programs throughout the United States and its territories. And we'll keep that up just for a little bit so folks can take a look. And as you see, colors are here is the state EMS offices and having other, where they're locations of each program. Some do affiliate with School of Medicines. All right, and I think we're ready for our next slide. Our ED members, just a little bit of background about who they are. So we have ED team represented here. They are physicians, nurses, social workers, and staff, and other staff that have been participating or were participants of the ED Stop Suicide QI Collaborative in 2023. In that time, during the collaborative, the focus was on enhancing ED-based clinical care processes for children with suicidal ideations. So we have folks joining from that cohort as well today.
And
next.
I'll add one note to that too for our returning PMHCAs, and just for some context, the PMHCA teams that we worked with last year had the opportunity to listen in on this particular collaborative, really to be listener learners. So we are hopeful that ED members from that collaborative could also act in that role going forward for this year.
Thank you. So the objectives, what do we want to get out of today? We would like to identify specific areas, or we call it a QI term, a global aim, that each PMHCA team who are participating will be working on. And I know that the focus is of that goal will be your ED expansion project. For EDs and EMHC state partners program attendees, we would like to hopefully start thinking about exploring your organizations and teams' interest in engaging and partnering with your state's PMHCA team. And I'm sure I'm forgetting something in this one.
No, I think you're good. Again, I think for the PMHCA teams, we understand that you're all at very different places and participating in this collaborative. And so we want to acknowledge that even if you're in the state of exploration, there's still a QI project associated with that. So we're excited for you to be here. And really for everybody else, for EDs, EMSC state partner program attendees, but also PMHCAs who aren't participating in the collaborative, we invite you to listen and learn and think of potential opportunities for engagement down the road.
Thank you. Next slide. So why quality improvement? We're hoping with the next few slides, we will convince you as to why this work is such an important work and how we perceive this happening and going forward with this collaborative. And hopefully this will provide the opportunity to understand some of the components. And with that, I'm going to give it to my wonderful colleague, Jen.
Cool. Thanks, Anna. All right. So I know many of you have already heard the wonders that I've probably presented in the past on quality improvement, but we love to really harken in on the importance of it. So again, you are participating in a collaborative. Why is that important? It offers a myriad of different benefits to you as the participant, but really also, again, if you're just a listener and learner, it's still beneficial. You're going to reap the benefits of the education we provide. Benefits include expert support and testing strategies. So again, you being a part of this collaborative is you're coming to the table and really trying to explore what opportunities there are within ED expansion work. Not only will you have the experts that we provide from the EIIC, but really you're experts in your own ways, in your own states, in your own policies and procedures. It's very much teach one, learn one. So you are all experts in this field as well. We have a lot to learn from you too. We offer centralized resources and assistance. Again, being in this collaborative, we have resources that are directed specifically at the efforts that you are going to be putting forth while participating, as well as our technical assistance through our different subject matter experts, those on the call, but as well as those that we bring to the table during our webinars. I mentioned all teach and all learn. Again, this is where you kind of train the trainer, essentially. We are teaching you, but we're learning from you as well. So it's really reciprocal between groups. It's an opportunity for us to learn, but for you to learn as well. Diversity participants, again, you all represent different states and territories. You all have very different really experiences and application with the work that you're doing. And it's very beneficial to get you all in the room, even if you're at very different places in your work, whether you're just starting out or you're just kind of exploring the space, or whether you've been off and running for the past year already, getting that work underway. We need you here. And then really lasting results. Research has really shown that the benefits of a collaborative are immense. Typically, when we see things put out, going through studies and research, it could take years and years and years until we see a best practice actually, hit the ground running in the real world. Collaboratives really serve to expedite that process. So again, having you all here identifying what works and what doesn't in ED expansion, the learnings that we really gain here, that you create here, is what we can perpetuate out to the greater PMHCA program. All right, so within the collaborative, I've listed all the benefits. So what are some of the key activities, you wonder? So again, all around quality improvement, we're really focused on identifying the change you want to make. Quality improvement is all about identifying where can we make improvements, but also really understanding, did the change we make actually make the intended improvement that we were seeking? So what we are going to be doing through the course of this collaborative is identifying what is it that you're trying to do in your ED expansion efforts. Through that, we will help you develop a SMART aim. What that really entails is just getting very specific about your goals. And if you've attended previous presentations, a goal is only as good as the definition you give it. So the more specific that we can get, the better our plans will be to achieve our intended outcome. Will help design your plan for change. And again, using change, it's really just looking at your current project work, but really developing a detailed plan of execution, making sure, again, that everything that you're doing is not wasted time and is really targeted towards efficiency. We'll do small tests of change. That's the beauty of quality improvement. We have very big goals that we are trying to achieve, and they can be daunting. But what we really want to do is break down some of the big, scary things into more micro, bite-sized pieces to make change efforts sustainable over time. And if something doesn't work, we want to nix it and try something else. We want to measure. Measurement is important. Again, how did you know you made an improvement? So we really want to focus on measure development and seeing, are you actually capturing that information to really demonstrate the impact that your program is making? And then finally, we live by the 3 A's: adapt, adopt, or abandon. So as we're going through different change strategies and identifying ways that we can make improvements, we can look at what we test and say, hey, you know what, this was good, but we need to make some slight changes. We say, hey, this worked, this is it, we're going to adopt it and spread it wide. Or we're like, you know what, that didn't quite work out, we're going to abandon it totally and just go a different direction. So all of this, I've thrown a lot of information at you, but again, being a part of this collaborative, we're trying to break this down into very bite-sized pieces. So you all feel comfortable with the tools and resources that we're giving you, and ultimately will really support your project work in the long run. So within quality improvement, we follow the Institute for Healthcare Improvement's model for improvement, or the IHI. Some of you might be very familiar with it, others might not be, or maybe just a little bit. Really, we're trying to answer 3 important questions. So 1, what is it that we're trying to accomplish? What's our goal? What are we trying to do? Second, it's the how. How will we know that a change is an improvement? You can have a change, but it might not necessarily be a good one. And then finally, what change can we make that will result in an improvement? And so these are 3 fundamental questions that we will be asking ourselves repeatedly throughout the duration of this collaborative and as you're going through your own work. And within that too, I mentioned doing small tests of change. It's really this continuous cycle of we plan it, we do it, we study how we did it, and then we act on it depending on where we want to go. So again, really, like anything, if you're trying to achieve any goal in your professional or personal life, it really is trying things and seeing if they work. And if they don't, move on to the next thing. We don't want to linger too long on something that isn't quite working. And so at its simplest, looking at quality improvement, we have a goal. We're very specific about that goal with developing a SMART aim and then really planning that change, making a plan that will lead to a successful implementation and hopefully a positive outcome. And as an important note too, as we've reiterated, not all changes lead to improvement, but all improvement requires change. Just a quick little primer on this. And again, we're throwing a lot of information at you, but don't worry, we have more sessions and education to provide you after this as well. So if it doesn't sink in this first time, that is okay. We will have a lot of information for you. So we talk about the Plan, Do, Study Act, or Study and Act, or the PDSA cycle. It's a fancy way of saying, hey, I'm going to try this and assess whether or not it actually worked. And if it didn't, I'm going to adapt it or maybe totally abandon it and try something new. So planning is looking at, developing your SMART aim, developing your plans. A lot of you already did that with your work plans. You have a plan. You have something that you've outlined that you're trying to achieve. The next stage in that is doing it. You're putting your plan into action. And this is where you want to try those simple, rapid tests of change. Try a little bit and see how you do and just kind of micro do it forward, lack of a better term. Study it. You want to analyze whether or not your change effort worked or not. And then finally act, determining whether or not that's a long-term strategy going forward. That's a lot, but don't worry, we're here right now. It's really just around the planning. And again, a lot of you are already coming in with plans or maybe just ideas of plans. But what we're really looking forward to helping you do at this stage is just break down that plan a little bit more. And I won't linger on this too much, but if you're a nerd around quality improvement science, this just kind of gives you a 30,000-foot view of what the life cycle is of a collaborative. So again, we're at this very early stage of, pre-work. You're starting, like we've had a series of, different pre-meetings, really just getting you acquainted to the work at hand. And so we're very much at the beginning, introducing you to these concepts, and really just exploring who you are, what it is that you're hoping to achieve, and what are your goals in being a part of this collaborative. And so thank you. Please bear with us over the next, couple of months, but we look forward to engaging with you in each of these little sections of work. So with that, what will you be learning? Again, I threw a bunch of information out at you. We'll give you all of those resources. There are quality improvement tools and methods that you can use to apply to your work. QI is very applicable. It has a lot of different, fancy scientific names for it, but it really is application focused. It's really looking at theory and putting, where rubber meets the road. How is this actually going to work in real life? We'll identify strategies to develop more defined goals for you. Measurement has something that has come up frequently with these discussions. I know that PMHCAs have their own performance measures that they are tracking. However, we want to look specifically at the ED expansion specific measures and what that looks like. So we want to build those out specific to your program, but more widely, how can we contribute to more meaningful measures around ED expansion as a whole? Again, you are sitting at the table with a lot of your fellow colleagues. And so we want to expose you to other examples from other teams regarding their ED expansion work. So again, for the teams that maybe are just kind of sussing that out and see if this is a viable path for them, you'll get to hear from teams who are further ahead in their ED expansion work, ask questions, see if it's a good fit for your team. You have that exposure here. And then again, we've invited ED and EMSC state partners to the table because again, these are crucial individuals residing in your communities and states and regions. And we see opportunities, from both sides where you can listen and learn from one another and see how you can mutually benefit from a collaboration together. So all of that, there are some expectations. We don't want to necessarily scare you, but again, you being here, you will reap the benefits of all of this by meeting these. So again, we want you active and engaged. We want you to speak up. We want you to be vocal and be upfront about your work. There's no use in being quiet here. We're loud, we're opinionated, we like to talk. We want to hear from you. This is really good information to share with each other as well as us. We ask that you attend these large group sessions, not only today, but the sessions going forward. Again, you're going to get educated on different strategies, materials, resources. You'll be face-to-face with other experts in the field that you can glean wisdom from. So we ask that you attend those sessions. We also want to hear from you, providing regular progress updates on your work. Again, even if you're struggling and encountering barriers or not feeling like you're moving very far in your work, that's okay. That's still feedback that we need to hear, but I think also your fellow colleagues need to hear as well to see how maybe we can help you move forward. Active participation, it's a little redundant, but again, we have smaller working sessions where we'll pair you off into more like groups. If you have teams that are doing similar work, we want to pair you with those teams so you can get the most benefit in that work, but we want you to participate in that. Office hours, they're not mandatory, but we highly, highly encourage them. There's more education and resources that we offer during that time, but it's also an opportunity to meet with our team in a smaller setting or even one-on-one to help you with your work. And again, even if you're in that exploratory phase, we want to meet with you and talk through some of your thoughts and maybe struggles. That's where it goes the one-on-one time. Again, if you can't attend our larger meetings, but you still want to meet with us, we still want to meet with you, see where we can do some coaching and identify any areas of opportunity. And then really too, this information is great, but it's only as good as the effort you put behind it. So we want you to test out some of these methods. Again, we have activities like developing a SMART aim, doing these PDSA cycles and doing small tests of change. We want you to apply the things that you learn here in this collaborative into your own work. We really want to be conscientious to your time. And we understand that a lot of you, again, there's already a lot of work on your plate. We look at this as a value add and extra tools in your tool belt to apply to the work that's already being done. And again, don't want to leave out our guests who are visiting, EDs, EMSC partners, and again, PMHCAs who aren't active in our collaborative but are here to learn. Again, we want you here as listener learners. We're really challenging you to all just think about what opportunities there may be If you're a PMHCA who isn't in the ED expansion space yet, but is thinking about it, we invite you to listen and learn and see what opportunities there may be for you down the road. Same thing with EDs and EMSC state partners. Again, thinking about your own goals and your own programmatic efforts. Where could a PMHCA potentially be beneficial in your processes? I promise I'm almost done talking. So we've talked a lot about the QI, why it's important. And then going forward, we have listened to a lot of different PMHCA teams who are approaching this work in very different ways. But the best way that we've been able to break down the work as it relates to ED expansion related efforts is around these three pathways. And these three pathways will be important going forward because, again, if you fall into one of these paths or multiple, we want to pair you up with teams who might be a little bit further along in those endeavors so you can listen and learn and gain value in your own project work. And so I'll go into each one of these pretty quick. So education and training, again, looking at provider-specific things. Your team may engage ED providers by offering resources, training, education to ED providers and their staff. These efforts are specific to providers and really aim to educate and empower providers in specific areas regarding mental and behavioral health. Second path, teleconsultation. Again, a lot of you have done this in the primary care space. Similar, your team may want to continue that and engage ED providers in offering some kind of provider-to-provider consultation. And that consultation could look a number of different ways. It could look at, providing guidance on specific screenings. It could be offering, maybe some direction around medication management, guidance on discharge and safety planning. We've heard some fun examples too from teams of, hosting weekly office hours where they bring a mental and behavioral health specialist to the table to interact with ED providers. And then finally, this is where, your team may determine that it can serve as a point of, resource connection to emergency departments. That could look like, providing guidance on resources that are out in the community to providers. You may want to use different kinds of technologies or telehealth platforms to facilitate that kind of resource connection. And I know that a lot of teams don't do this, but I know that some teams have thought about it, is what would it look like to offer telepsychiatry services to patients? Obviously, that entails its own, level of liability, but I know that I've heard a few teams express, what that might be one day. So that was a lot of information, a lot to pour on you. Don't worry, we will share this information with you post-meeting. But right now is really a time that we want to get to know you. We've all had a chance, at least on the EIIC side, to individually meet with you all. But now is the time where you can meet your other colleagues who are participating in this collaborative. So pretty brief, but we'd love to know who you are. So introduce who you are, if you have any other team members on the call with you, what program you represent, what is your team's ED expansion plan, or even if you're exploring, we want to hear that too. But I think most importantly, we want to know, what do you hope to gain from this collaborative? Why are you here? Because you have decided to take the time out of your day to join this, and we are so appreciative of you doing that. So my colleague will kick us off into breakout rooms. If you do not have a pre-assigned breakout room, we will assign you to one, or if you're able to join on your end, just hop into one that you want. But for those who are active participants in our QI collaborative, we have assigned you to breakout rooms.
Thank you, Jen. This was wonderful. Dr. Sherry Snyder is going to help us to get into the breakout rooms.
Okay, if everybody just bears with me, Gabby just told me that she is with North Carolina, so let me just get her into her breakout room, and then I will go ahead and hit go. And what you guys are going to have to do is, it will ask you to join. Go ahead and hit the join button. It will separate you into your rooms. Group 1 is going to be with your leaders of Anna, Hannah, and Kim. Group 2 will be with Jen, Eleni, and Angela. You will automatically, after 40 minutes, you will see a room will close in 60 seconds. It will automatically bring you back into the bigger room, so you won't have to do anything unless you want to leave on your own. Do not hit leave meeting, just if you want to leave on your own. If you hit leave meeting, you will leave us forever, and then we'll see you at the next collaborative. you can always rejoin us. Just go ahead and hit leave the room and you'll be brought back into the bigger meeting room. If for some reason you end up being kicked out, rejoin the meeting. I'll put you back into your into the breakout room and you'll be okay. You guys will receive, just for the leader's perspective, you'll have 10 minutes left, like a 10-minute warning, a 5-minute warning, and then a 1-minute warning to wrap up. I'm sure you guys all have lots of things to say as you get to know each other, and enjoy your time together. And we'll see you in a little bit.
Thank you, Sarah.
Bye, everyone. Hopefully. Jessica, do you have a space?
Thank you, Sherry. All right, this is the time where we're going to share our learnings. I believe my colleague Eleni will start with a quick report of what we learned about groups.
Sure. So we definitely have such amazing work going on currently. Speaking in terms of pathway focuses, we really have a wide variety. We have a lot of teams focusing on direct provider to provider consultation. We also have lots of different educational trainings that are going to be implemented. We also have a lot of patient resource connection happening as well. Jen, I don't know if you wanna, or Angela too, can jump in on some more of the specifics as well.
Sure. This is Jen. I can highlight some other areas too that I think with any kind of ED expansion effort, like any project work, you'll hit barriers or some challenges. And so some initial barriers that we'd heard of, or just wanting to know more about, having ED providers who are interested or have expressed interest in getting continuing medical education credits. That was one that was brought up. Another barrier too is, trying to engage with their EMSC state partner, but not necessarily making that headway or making that connection just yet. I think also one too, and I think this is important to note that, not everybody is working with a children's hospital and doesn't have the benefit of having pediatric physicians who understand the need or just understand the nuances for pediatrics versus adults. We had some teams express that they're working with adult physicians. And so having more of that pediatric focus and education is crucial, but might also, they might encounter some barriers or challenges in getting those physicians comfortable with working with pediatric patients. So acknowledge that there's probably many other teams here too that might not necessarily have the benefit of working with a children's hospital, but are working with more adult-based care providers. And I don't know, Angela, if you had anything additional.
No, I think it was a great combination. I would love to hear about from some of the folks that were here from returning from last year and kind of some of the progress they've made or some of the projects that they're about to launch. So it was great to hear everything.
All right, thank you, everyone. I'm going to report back on our group. We had a number of teams joining Tennessee, Michigan, North Carolina, Vermont, and representation from Ohio Department of Health, as well as PA, ED. So this was interesting, a learning opportunity to kind of get to know one another. We've also identified pathways for majority of us. It was educational to ED providers, as well as consultation lines, where some of the folks are embarking on that journey. And it was interesting to hear that some of the groups are addressing health equity. with that education. So it was a little bit of a newer component to the previous work. So some of the teams are returning and a little bit further along on their projects, and some of them are there to learn. That's all I can think of or remember or in my notes. So I'm gonna punt it to my colleague, Kim Burkhardt. Dr. Burkhardt, do you have anything to add?
I do not. I think you summarized it well. It was helpful to see where the states are in their project development and the exciting things that they've been able to do with the funding.
Okay, Hannah, is there something that we might have missed?
No, I think that was good. I mean, there was a lot of provider education that I thought was very interesting, and then we had a pick on our call. So thank you for joining us. So that was good.
All right, great. With that, I think we are at the point of moving along, Jen, to the next slide.
All right. So we are going to wrap this up. We know we have about 14 minutes left. So next steps, you're probably wondering, what are we doing? So we really are grateful for you sharing your work. What we plan on doing for our April collaborative meetings, again, since we have a large cohort, we want to separate you all into your specific areas of focus. Again, those who are focused more on teleconsultation, we want to put you together, education and training, we want to put you guys together, and then resource connection, those that are really branching out into the community, we want to put you together. You might be thinking to yourself, I do all of these, or I do more than one. We are not just limiting you to one. If you want to join more than one, you are welcome to. And heck, if you are interested in just joining all of these to listen from your other peers, we welcome you to do that as well. But that'll be a time where we'll really work on, developing those SMART aim statements and really getting into the weeds of your work and pinpointing areas around your QI efforts. And so that's where we'll get into the SMART aim drafting, which I have a little bit of information on in the coming slides.
So these are more of a working, just to reiterate, these are going to be working sessions. We're actually going to be drafting the aims together. So prepare to work, I guess, is an additional message. Thank you. Jen, go ahead.
All right. So again, those sessions are April 4th, April 18th, and April 25th. We will send those out to you, but they're all 2 to 3 p.m. Eastern Standard. If those don't work for you, that's totally fine. We can meet with you one-on-one. And again, if there's multiple of you, we might just cluster you all together at a time that works best. So again, we want to make sure that you reap the benefits of having that focus time with a quality improvement coach, as well as some of our other team members. So I want to touch on this because we talked about it a lot. We say it, be smart when you develop your goals. And again, this is creating something that's specific, measurable, achievable, realistic, and time-bound. Again, likely all of you have created some version of this in your work plans already, but we really want to just ensure that you are defining as clearly as possible what it is that you're trying to achieve as it relates to this collaborative. So highlighting that this aim statement is a clear, explicit summary of what your team hopes to achieve over a very specific amount of time, including the magnitude of change you wish to achieve. So not just saying, we want to do better, we want to do 90% better, really attaching those numbers to it. And this is more narrow. We use a lot of different words. You might hear global aim, you might hear SMART aim. Your global aim is really just big picture. What are you trying to do? While your SMART aim is way more specific. So an example, this is from one of our teams from last year. They were looking to increase the percentage of suicide screenings at their hospital's ED from 10% to 90% by June 2025. So again, it's specific. We're looking specifically at suicide screenings. It's measurable. We are wanting that increase from 10% to 90%. So we are looking at a way to actually measure that. It's achievable. Again, this team has a working relationship with that ED. So for them, that is an achievable goal since they are working in partnership with them. It's relevant. It's relevant to the work that they set out to do in their work plan. And it's also time bound. They set a goal of June 2025. So they're holding themselves to that. So with that, on February 1st, we had hosted an office hour. Some of you attended But if you have not, we record all of our meetings. So in addition to some resources we sent out to you prior to this session, we do have some recordings that you can listen to as well. So we will point you to those resources post-session. We've also provided a QI introduction guide. Again, it's really just high-level information to get you acquainted with different QI methods and resources. We also have an upcoming session on March 26th, an office hour, again, specific to quality improvement, again, where you can work through some of the questions you might have, or any issues you might be experiencing as you're working through this stuff. And then upcoming webinars, because we are, goodness, almost at March 5th. We have a whole host of different technical assistance webinars. I put a plug in during our session that we have a list of different topics. If there's something on there that you would like to see, if there's an area that maybe you're particularly interested in or struggling with that is not listed there, we definitely want to hear from you and tap into our group of experts. So March 5th is we're introducing our technical assistance toolkit. So for some of you who might not know, year one, along with working with our awesome PMHCA teams, we developed a technical assistance toolkit. Very, very big thanks to all those teams who helped contribute the material that's in there. This resource is really for teams who are looking at expanding their services into the emergency department. It is a broad resource that we really try to be as all-encompassing as possible, acknowledging that each of your teams is very unique and has its own different nuances of consideration. Knowing that this resource can be a little daunting, we are scheduling tutorials. We have 3 separate ones. Our kickoff one is on March 5th, really introducing you to this toolkit, but also showing just application, what does that look like, and pulling in some of our returning teams to showcase what that looks like and how you can apply it to the toolkit. So that's the 5th. March 19th, we are bringing in a colleague from North Carolina statewide telepsychiatry program, specifically looking at how to make telehealth work in the emergency department. This will be a great resource for you, even if you're not necessarily looking at applying telehealth modalities to your work. This is just a really good webinar just to listen in on establishing those emergency department relationships. I know that that has been a common theme for a lot of teams. Some have the benefit of already being connected with an emergency department, but others are still working on getting that relationship established. So this will also be a component of the webinar as well. And then, like I said, March 26th, office hours, again, quality improvement focused. Bring your questions, bring your issues. We are there for you. And then for our collaborative members, I just want to make a note that this is for those who have signed up for the collaborative. We do offer the opportunity to come to Cleveland in person. It's an opportunity for you all to meet together face-to-face to continue the work that we're doing here in our virtual environment. And nothing's better than face-to-face time. So that, save those dates, July 22nd through the 24th. We are actively developing our agenda, but we are excited for some of the areas that we are going to be focusing on, such as emergency care pathways, really understanding the inner workings of an emergency department, as well as what providers are looking for specifically around mental and behavioral health processes, bringing in educators around that, technology, data and analytics. A big focus for us is measurement development. Again, as we mentioned earlier, we understand that you all have performance measures as a PMHCA program, but specifically we want to highlight what are some very meaningful measures that are relevant to not only your specific work around ED expansion, but more broadly, what are some key measures that maybe we need to consider for just ED expansion work as a whole. So measurement is going to be a major focus for this time, but it's also just a really good time for you all to connect with each other in person. And I'll leave that information up there just for a second longer. If you want to scan that QR code, that'll take you to our website. We'll also drop some links either in the chat or post follow-up where you can find more information as well. So save the date, details to come.
We had a question in our breakout room. For those did ask, all the information is on the website and has dates for the future collaboratives, times, and how to register.
Thanks, Anna.
That's all I wanted to add. Thank you.
No, you're good. Well, with that, that is the end of our presentation, but we have a few minutes left. We'd love to open the floor for any questions or comments from the group, or any fun learnings that you would like to share. And I know that there was an evaluative question dropped in the chat. Before you leave us today, if you don't mind answering that, that would be fantastic. Once you have, you are free to go. We're really grateful for everyone's participation today. We look forward to working with you more over the coming months. I know it'll be a lot of work, but we're excited to work alongside with you and really help you in your expansion efforts, even if you're just in the exploratory phase. So thank you.
I wanted to just put a little plug in. We have a few teams who have joined us and provided slides with their presentation. If you don't mind, we would like to gather them. Please email them to me, Anna Goldman at uhhospitals.org, so I can then share with others with your permission. Appreciate it. Bye, everyone.
Thanks all.